Good morning. Welcome to a new era. Hi, I am Dr. Arvind Poswal from Dr. A's Clinic, Delhi, India. Today we will be talking about gene therapy for hair loss. Before starting, let me tell you that yes, there is a conflict of interest. We have a company called Live Natural Products Private Limited that specializes in providing anti-aging and gene therapy products for doctors as well as patients. Now, recent advances in epigenetics and anti-aging medicine has discovered what I call molecules of interest, which influence our cells, including our stem cells, at a genetic level. Let us use this knowledge. It will help us provide better and holistic treatment for hair loss right from the gene level. Indications for gene therapy for hair loss are androgenic alopecia or male pattern hair loss, telogen effluvium, hair loss in autoimmune conditions, hair loss in chemotherapy and radiotherapy, hair loss after pregnancy and childbirth, and after post-infections, after COVID or any severe illness. Sometimes acute stress can also lead to hair loss. In all these conditions, gene therapy for hair loss comes in handy. Before we start, let's understand why is it called gene therapy. So these are some necessary definitions. Gene therapy is defined as when a product or a process is used to influence or modify the expression of a gene. Now, what is gene expression? It is the process by which information from the gene is used in the synthesis of a functional gene product that enables it to produce end products. That is, gene expression is when the gene makes proteins or RNA, which in turn makes the phenotype of the person. Now, there are certain molecules which have come to notice: resveratrol, fisetin, nicotinamide mononucleotide or NMN, grapeseed extract, etc. These act on the genes to modify their expression, and we use them. That is why this is called gene therapy for hair loss. Now, what are these molecules of interest? These are resveratrol, NMN, fisetin, grapeseed extract, alpha-ketoglutarate or AKG, rapamycin, epigenin, and more. What are the scientific findings? See, when resveratrol or fisetin are placed into the skin or intradermally, they increased TERT. So what is TERT? It is telomerase reverse transcriptase. So it increases the level of TERT around and in the hair follicle. To understand it simply, our telomeres get shorter and shorter as the hair keep on growing. There comes an age and a time when the telomeres become very short. After that, the stem cells cannot divide, and then we notice hair fall or miniaturized hair. So by increasing the TERT, telomerase reverse transcriptase, we can again increase the length of the telomeres. And when we use resveratrol or fisetin, this TERT gets increased. There is also an increase in Ki67 cells around the dermal papilla. Both of these conditions stimulate the stem cells present in the hair follicle bulge area. These stem cells then multiply, resulting in pushing the hair from telogen or its resting phase to anagen or its growing phase. Now, fisetin, normally it is present in strawberries, but if you want to take the daily intake of fisetin from strawberries alone, you will need to eat about 200 strawberries every day for the rest of your life. But let's understand what is fisetin. Fisetin is a senolytic. A senolytic is a drug or a supplement or a molecule which kills senescent cells. Senescent cells are those cells which neither become cancer nor do they die off. They just become old, they do not multiply, and they produce harmful chemicals instead of doing their own work. And these harmful chemicals also affect the surrounding cells, and as a result, those cells also become senescent or senile. So fisetin removes the senile melanocytes from the hair follicle, resulting in improved hair growth and also possibly reversal of hair graying. Then calcium alpha ketoglutarate or alpha ketoglutarate and rapamycin. Now telogen hair follicles can be stimulated to initiate anagen and hair growth by small molecules that activate autophagy. These molecules include alpha ketoglutarate, calcium AKG or rapamycin and metformin. All of these small molecules have their effect on the stem cells, and they push the stem cells into the multiplication phase or anagen, and you see hair growth. Then we come to NMN. NMN is a NAD precursor. NAD is energy. Hair is one of the fastest multiplying organ of the body. Stem cells need NAD for normal multiplication. That is where NMN, when it is introduced intradermally, it increases stem cell proliferation, resulting in improved hair growth. Similarly, grapeseed extract, when placed into the skin or intradermally, leads to proliferation of hair follicle stem cells. All these things ultimately cause your stem cells to multiply, and multiplying stem cells lead to improved hair growth, better hair growth. Now the process of gene therapy. Our efforts have been focused on applying the research and findings into clinical settings successfully. The difficulties in replicating the research's positive effects are due to transplanting the molecules, that is NMN, resveratrol, AKG, etc. They have to be transferred in a suitable medium to the desired target at the optimum frequency and at the correct dose. So the steps one by one are, when you are doing it for your patients, you clean and wet their head, clean and wet scalp. Use a derma roller or a derma pen or a derma stamp with at least 1 millimeter depth needles to create fine channels in the scalp to facilitate entry of resveratrol and other molecules into the scalp skin. Next step is, once the derma roller has done its work, apply resveratrol, grapeseed extract, fisetin lotion, astragalus serum, and freshly prepared NMN lotion. You can use them all, or you can use a couple of them at a time. At the same time, orally, to improve the chances of hair regrowth, you take senolytic autophagy activator. This includes fisetin and epigenin, and these act by removing the senescent cells as well as removing the deformed proteins and aged or dead cells, etc. Then also take stem cell booster, which contains NMN and trimethylglycine or TMG along with moringa. The third is, glutathione is very difficult to absorb from the stomach, so we give a combination of glycine and N-acetylcysteine. These are later converted in the liver to glutathione, and it has all the wonderful benefits of a master antioxidant of the body. Then fourth, we give the building blocks and vitamins, that is omega, biotin, amino acids, etc. and also collagen and hyaluronic acid. This is one of my first gene therapy result. As you can see, there is a tremendous hair growth without using minoxidil or finasteride. No finasteride or minoxidil or PRP was used in this case. And in this close-up picture, you can see the strong, short but strong hair growing in the area of hair thinning. This was just 3 months after the start of gene therapy for the patient. Gene therapy for hair loss also helps in lady patients or female patients. It helps to increase the hair length as well as the hair diameter and thickness. It also helped me in conditions like this where the patient had progressive hair loss in the crown area. There was a significant hair growth, and as a result, he did not require a transplant after gene therapy in the crown area. And another result. So we have a lot of positive experiences. All the patients who go for this are experiencing almost nil hair loss as soon as a week or 2 weeks after the procedure, and much stronger hair with thickening of the hair follicle in about 2 months' time. Now this is a diagrammatic representation of a hair follicle. Here you can see what is it we aim to do. Our aim is to reduce the reactive oxygen species which damage the cells, increase the TERT which will re-lengthen the telomere or re-elongate the telomeres, increase the NAD levels so that there is enough energy for the stem cells to multiply, reduce or get rid of senescent cells so that harmful environment can be removed, and reduce the inflammaging. Inflammaging is a combination of inflammation and aging. How do we do that? We start with the building blocks. So patients should be given biotin, iron, vitamins, the required amino acids. Then EGCG, fisetin and resveratrol. All these three act as antioxidant also. They protect the stem cells from oxidative stress and they increase the TERT level so that the stem cells start multiplying. Then we have the senolytics autophagy activators, which are fisetin, epigenin, quercetin, which get rid of all the senescent cells, the malformed, deformed cells, aged cells, and wrong proteins. Then comes the master antioxidant, which is glutathione. Glutathione, as I said before, we give a combination of NAC and glycine so that the patient's body itself produces the required glutathione, which protects the hair follicles. NMN and grapeseed extract. NMN increases the NAD level, which are very important, and grapeseed extract also stimulates the stem cell to multiply. Then we supply the collagen and hyaluronic acid, which will repair the perifollicular matrix, that is the surroundings of the hair follicle root. In near future, we should be seeing benefits of peptides, which are anti-inflammatory in nature, and they also supply the missing amino acid sequencing so that the hair can get all the amino acids required for it to grow in a normal fashion. These include BPC157 and follistatin. So the aim of all these three things is to have healthy multiplying stem cells. We have healthy multiplying stem cells, which means we can actually fight against the genetic problem of hair fall or baldness. Some precautions. While most of these molecules are safe, we advise caution in pregnant and lactating females. They should avoid these therapies. Now let's see the changes at the cellular level. NMN and grapeseed extract induce increased proliferation or multiplication of stem cells of the thinning or miniaturizing hair follicles, and also in the hair in forced telogen phase, that is telogen effluvium. Resveratrol and fisetin increase the TERT levels in skin and increase rapidly multiplying Ki67 cells around the hair follicle. When this happens, it stimulates the stem cells in the hair bulge area to start multiplying. Fisetin, a senolytic, destroys the senescent cells. All of these also protect the niche of stem cells in the bulge area of the hair follicle, thus effectively reversing the hair loss process. Also, on oral intake, collagen and hyaluronic acid improve the perifollicular matrix. NMN, which acts as a NAD precursor, provides energy for the stem cells. Glutathione, produced in liver using glycine and NEC, acts as the body's master antioxidant to mitigate damage due to reactive oxygen species and hydrogen peroxide. Fisetin and epigenin act as senolytic as well as autophagy activators, removing damaged proteins and senescent cells. It is also very important to understand the importance of epigenome and its optimization. Epigenome is our internal body environment. A healthy epigenome is a prerequisite for healthy hair growth. Our epigenome affects our genes, so that under the influence of epigenome, the genes do different functions, make different proteins at different ages. Epigenome improvement includes a range of measures to address and correct the lifestyle anomalies. This also includes diet, sleep, breathing exercises, cold showers, intermittent fasting, etc. Individual lifestyle issues need to be elicited and corrected. A good way is to encourage the patient to share his or her thoughts on the likely lifestyle causes of their hair loss. So they may say that they started experiencing hair loss after a period of severe stress or severe dieting or change of residence or change of water, etc. This also helps patient understand that lifestyle changes can have an impact on hair loss as well as hair regrowth. It is not just the tablets and the pills which are going to do the work. Now the future. The future is delivering select proteins or RNA made by genes directly into the bloodstream. These include potent stem cell differentiators, which help stem cells complete their differentiation to the desired tissue type. Humans using them have noticed improved age reversal and better hair regrowth. But we are waiting for more results. Then injecting of the RNA or gene material through intravenous or intranasal route is also in future. While the above may be even more effective way of reversing hair loss and skin aging, it requires safety studies that are being conducted. Thank you.